everyone, welcome to Womanity Africa on TOS TV network, where we discuss women-related issues. On this episode, we'll be discussing on dysmenorrhea, the chronic pains associated with periods. I am Fawcett Bello. Menstruation, also called period, is a normal and healthy part of life for most women who are of reproductive age. Most women menstruate each month for about 3 to 7 days. This time in a month, however, comes with pain, medically referred to as dysmenorrhea. Majority of women experience period pain at some point in life, which is also a normal part of the menstrual cycle. Some women experience discomfort during their periods, which can be bearable for them, while some experience chronic pain severe enough to disrupt their lives and activities for a few days each month.
Some months it can be really painful, and some other months it's not as painful. It depends on the sugar intake I had in that month. Yeah, that really affects it. So it makes it maybe more painful or less painful.
Me as a person, I get PMS before my period, where you tend to get angry at every little thing that happens. You just get triggered on things that you're not supposed to get angry about. And then I get severe back pain. Like the pain just comes like, I don't know if you know what arthritis feels like.
Sometimes the pains get so severe that I start throwing up, I start going to toilets on a regular, I get so uncomfortable, and if I'm in a certain space when I'm having period pain, I literally hate everybody in that space because everybody there disgusts me. I don't want to be around anything, I don't want to be around it. Sometimes I barely even walk or get out of bed because the pain gets so severe, and sometimes the bed gets uncomfortable, I have to go to the floor.
So some months I feel this very terrible headache. Comes like migraine, but it's not. It's like you're losing blood and then you're stressing out. You're stressing yourself and then you feel this kind of headache. And then the pain, this pelvic pain, when I have that headache, is usually intense. That most of the time you just have to lie down to ease yourself.
My period it hurts so much. I only have back aches, stomach aches, especially when I take too many sweet things before my period comes. The pain is going to be excruciating. And the thing is, I don't take anything. I don't take any medication.
I usually have this sharp pain in my stomach as the first symptoms when it's coming, and then there's always a waist pain. Like I have like this annoying waist pain. It's more or less like my waist, my back, like everything just hurts at that moment, and I'm like passing a menstrual cramps, so those are the symptoms I get. And most times when that happens, I am not productive. All I think of is how to lie down on my bed and sleep the whole day.
I will cry, I will vomit, and when I mean vomit, like I will throw up a lot, and then I won't even eat anything. So literally, I'll just see green things everywhere and I'll vomit a lot. I'll be so uncomfortable, I'll feel hot, and I also used to pause, like I'll go to the toilet a lot.
The symptoms I usually have are back pain, fuller breast, I have headache, and I get fatigued easily, and also the stomach pain, which is like the ojogbe of all symptoms.
My period pain comes 2 days before the actual period starts, stops on the second day, and comes back on the fourth day. I also have symptoms like diarrhea, headaches, back aches, waist pain, and swollen feet.
When my period starts, I have to deal with cramps. That makes me cry all through the night. It basically doesn't let me do stuffs, but it's something you have to deal with as a woman.
So most of the time, menstrual pain is really aggressive. That when I'm on my period and I sit for long, if I stand up, I won't be able to move. I have to pause and wait to get my legs back before I can move. While other time it just comes like nothing is happening, and then I just feel mild pain for like the second day, and then that's all.
I do not use painkillers for my period pains. I just take hot water. I drink very, very hot water. Then I try to sleep sometimes, and most times I take walks. The walks help ease the pain and also reduce the swelling in my feet.
I've tried using warm patches, like putting hot water on my tummy with something to just release the pain, but most times it doesn't work.
The cure for my cramps, I've been feeling okay ever since I started taking that. I just take Vitamin most of the time whenever I have cramps, and I feel okay. I might not eat all through, but I feel really okay.
So I use drugs because I just cannot handle it alone. So I use drugs to help me calm the pain and make me feel better.
I take ginger and lemon in warm water to ease the pain. And then while other time I just do it normal modern painkillers like Ferrovin and the rest of them.
I usually take medications. Paracetamol works for me, and also hot water therapy.
Most people take pills for this pain, but as a person, I don't. I just enjoy it because I feel the drugs wouldn't work for me. What you're not used to, you don't have to start it. So I just enjoy the pain.
Now that we've heard the different experiences of some women, here in the studio is Dr. Chika Odinaka Ezeokeke, Principal Medical Officer, Wuse District Hospital, with whom we share more knowledge on the topic of discussion. You're welcome to the studio, ma'am.
Thank you for having me.
So, can you please explain to us what the term dysmenorrhea means?
Okay, dysmenorrhea simply means painful menstruation. Broken down in 2 words, this, pain, menorrhea, the menstruation. So put together, painful menstruation.
What exactly are the causes of dysmenorrhea? Because I know most women experience painful menstruation.
Okay, medically, in terms of causes, for dysmenorrhea, we would say risk factors or existing factors, basically, because no particular cause has been held to be responsible for dysmenorrhea, basically, but it is known to be affected by a lot of risk factors. You understand? Number one, we know that people genetically, have dysmenorrhea. So if your mom experienced dysmenorrhea, there's a possibility that you would experience dysmenorrhea. Now, hearing that, we further split dysmenorrhea into 2. We have primary dysmenorrhea and secondary dysmenorrhea. Now, for primary dysmenorrhea, any cause of dysmenorrhea that has no pathology linked to it is primary dysmenorrhea, while secondary dysmenorrhea has a particular cause in the pelvis, linked to the secondary dysmenorrhea. So we're talking more about most of the time when people have dysmenorrhea, the regular one, we can't link any cause to it, any pelvic pathology, call it primary dysmenorrhea. That one is more of genetic and maybe some lifestyle changes that could actually predispose you to having that dysmenorrhea. But for the secondary causes, any pathology, any organic dysfunction of the pelvis generally could lead to dysmenorrhea.
Oh, okay. So what are things to look out for when a woman has dysmenorrhea?
Okay, so when a woman has dysmenorrhea, there's some things to look out for. When the patient comes to us, we have to examine the patient, ask a lot of questions to know if there are other symptoms associated with dysmenorrhea. Let's say if the patient has vomiting, if the pain is severe, there's a level of severity the pain can be. If it's associated with heavy bleeding, so the questions we ask: what age did the patient begin to experience this dysmenorrhea? We also ask for other factors like maybe does the person smoke? Is the person obese? We check up all those things. Now, furthermore, we'll go to examine the patient, looking out for other features, that could suggest a secondary, cause. The patient has fever, of course, we will be linking it to pelvic inflammatory disease. For example, if a patient who normally doesn't have dysmenorrhea or dysmenorrhea has not been as severe as it is presently, because that's actually what necessitates them to come and meet us in the hospital. So we further ask, do you have fever? Do you have other symptoms? And we look deep into the uterus. So when we are examining the patient, we go down to the uterine tube, you go down to the uterus, the cervix, to see if there are any cervical stenosis, uterine fibroid, uterine polyps. We do an ultrasound examination just to be sure that there is no other underlying features.
So are there any treatments that can be used to ease period pains? Because some people just take paracetamol, just normal painkillers that we all know. Are there any alternative treatments that can be used for period pains?
Like we know, for a patient to come to us, we know that this is beyond what the patient can cope with. So we have to, as much as possible, relieve pain. So pain relief is one of the measures. Now, there are many ways we can go about that. We'll start with the general lifestyle measures. If the patient was smoking, we'll advise them not to smoke.
So on smoking can cause...
Yes, is a risk factor for dysmenorrhia. Yes. So if the patient had any fever or anything, we'll treat the infection, and all that. If the patient, sometimes we can counsel on some dietary changes, lifestyle modification, dietary changes, because there's some diets that actually would help stimulate, as in reduce the dysmenorrhea. Then exercise actually helps relieve the pain. Then we can also advise them to do some basic things like using the hot water bottle, because heat actually helps relieve the pain. If that doesn't cause any relief, then we'll go further to place them on medications. There are a whole lot of medication. Most of them are classed under, we have majority of them classed under the non-steroidal anti-inflammatory drugs, NSAIDs, where you have your diclofenac, piroxicam, and a lot of others. And we have mefenamic acid. Then if in very, very severe cases, we could introduce hormones as a contraceptive, oral contraceptive pills, to actually help relieve in very severe cases. So those are the treatment, especially if it's associated with very heavy bleeding, can give mefenamic acid or tranexamic acid. So that's what we do.
So most women will say they don't like to take painkillers because they don't want their body to get used to the painkillers, and at a point to stop working. Yeah. So would you advise women to try taking painkillers when they deal with this period?
I would advise they should seek some medical guidance, taking painkillers, because we've had patients who took painkillers on overdose, and it led to an acute kidney injury, because that particular painkiller has a side effect, as in has nephropathy as a side effect. So they have to be guided on which ones they can use that are quite safe for them, especially when they want to use them for a very long period, during the period of cycle.
Some people say it's too much of junk, sweet things that cause period pains. Is that true?
Yeah, that's the general opinion. Okay. But there's no link. It has not been proven. Yes, there's no link to, there's no research that has come out to say it's because we eat sugary things. Okay. But
because I've seen people that eat sugary things that they don't even feel anything.
Yes, they don't have. So there's no direct link to dysmenorrhea, and people eat a lot of sugary things and they don't have that. So it's just the general conception. Oh, when I drink sugar, I notice that my period is more painful. But I don't think it is. Same person can also have some times where the periods are less severe and the periods are more painful. So it all depends.
So to wrap the show up, ma'am, how can a woman prevent dysmenorrhea?
Okay. Knowing the risk factors that could predispose you to having dysmenorrhea, the advice is to reduce everything that could lead to you having dysmenorrhea. So, number one, smoking, like I mentioned, is a risk factor. She has to be reduced. Diet, good high vegetable diet, diet high in vitamin E, pyridoxine, can actually help to relieve, And then for some persons who have dysmenorrhea, they could anticipate their cycle and begin to take the pain relief at the beginning, at the beginning of the cycle. You understand? In the normally prescribed form, not in excess, to anticipate their cycles, especially when their cycles are painful. A woman, there's this. Every woman gets a sign whenever
that's your period.
The period is coming. So once that happens, they can take the pain relief to actually relieve the effect, so they can carry out their regular duties. And then when the pain is more than what it's supposed to be, as in normally everybody knows how painful their menstrual periods can be. So if the pain becomes worse, they need to go for some checkup to see if there's any underlying problems, so that it can be sorted out. And the earlier it's sorted out, the better.
All right. Thank you very much for joining us on the show, ma. And this is how we wrap it here. Please don't forget to follow us on all our social media platforms at TOS TV Network on Instagram, Twitter, Facebook, and YouTube. Our website is www.tostvnetwork.com. Till we come your way again next week, I am Fausat Bellu.